Today we're going to be talking about NAD, and I just wanted to pop on and say hello before we start talk about NAD and just its function, how it can help you, different forms, all of that. So, like I said, we are talking about NAD, and it is a essential coenzyme in your body. And I will explain what that means, don't worry. We'll dive into it together. So, what is NAD? So basically, it's got this nice long name, but it stands for Nicotinamide Adenine Dinucleotide. And so while the name does sound complex, understanding its function is pretty straightforward. So if you can think of NAD as it's like crucial cellular currency that enables all these essential processes in our body to happen. It's called a coenzyme because it means that it's just a small molecule that's going to bind to your enzymes and it just helps them function properly. And it really is, it's ubiquitous in the human body. It's found in all living cells, from your brain to your muscles to your skin. Without coenzymes like NAD, many of our body's essential reactions just don't occur efficiently. So this makes NAD really critical for energy production, for cellular repair and maintenance, regulating our longevity pathways, and really facilitating that cell communication that's really vital for proper cellular function. So those are some of the basics, but the main things that it does. And so what is the role of NAD in energy and cellular function? Because I mean, I think we hear a lot about NAD and being like, oh yeah, we use it for energy. So if we go back to biology class, I'm always going back to biology and chemistry class and physics class. Biology was my favorite though. So NAD is an electron shuttle. I don't know if anyone remembers hearing about the electron shuttle in class, but it basically has a fundamental role in energy production. So when your body breaks down food like carbs and fats for energy, the NAD comes and picks up those electrons from the nutrients, and then they're carried to the mitochondria. And mitochondria is something we hear about a lot because it's the powerhouse of our cells. It's where ATP is generated, and ATP is the main energy currency of your cells. So we need that. We need that ATP. So what are mitochondria? You might look at this picture and maybe it brings back some vague memories, but mitochondria are those organelles that are responsible for producing ATP. And NAD is really, really important for the mitochondria to function efficiently. If you don't have enough NAD, the mitochondria cannot produce energy optimally, and then you have decreased cellular function and just overall decreased energy levels. So in metabolism, NAD is really important for these enzymatic reactions that will break down the nutrients that you take in from your food and convert them to energy. So again, really, really important for cellular energy, and just in general cellular function. Okay, so what about beyond energy? What else does NAD do? So there's a few different things. Everything from DNA repair. I opened up maps for some reason. Let me close that so it's not bouncing around and annoying me. Okay. Yes, so a few other functions. So DNA repair, something called sirtuin activity, and cell signaling. So what does this mean? So basically our DNA are constantly exposed to damage from many different sources, anything from like sunlight to pollution from our cars, and also just regular cellular processes. There's going to be some damage there. So what NAD does, it serves as a cofactor to help, basically cofactor for the certain enzymes. And there's these long names for it, but they're essentially called PARPs. And what they do is they go in and they detect and repair DNA damage. So that just helps keep your genetic information stable, because we don't want DNA damage. We want it to be, it does come along, it happens all the time, but we want something to come along and fix that. So NAD helps with that. Also helps with sirtuin activity. So what's sirtuin? Sirtuins are a family of proteins that are often referred to as longevity proteins. So you might have heard about these. The reason they're called that is because they play a role in regulating our cellular health, our metabolism, and our stress response. Um, And sirtuins, these longevity proteins, are actually dependent on NAD, meaning they cannot function without NAD. So they help to regulate our anti-aging genes and protect our cells from stress, all kinds of stress that we come across. And then lastly, cell signaling. So NAD itself is a signaling molecule, and it actually influences various signaling pathways within our cells. So it basically just helps our cells respond to changes in their environment. It helps to regulate growth. It helps to coordinate certain cellular processes, and it really is just overall vital for our tissue and organ function to just function optimally. I know we're getting into some of the nitty-gritty science, but I think it's important to know how these things work. Okay, so I think one of the main things that people ask about is NAD and aging. So yes, unfortunately, NAD does decrease as we age. Um, it goes down by middle age, our NAD levels can drop by as much as 50%. And this is really just because there's a shift in the balance between how much NAD we produce and how much NAD we consume over this time. So usually production decreases while consumption increases, leading to an overall net decline in NAD availability. So this is why we have such a drop. And there's lots of different things that can contribute to this decline. Sometimes there are certain enzymes like the PARPs that I mentioned before, something else called CD38. These increase as we age, and they're usually linked to things like inflammation, and so when these are more elevated, they're going to consume the NAD more. They're going to use up the NAD more because they need to. They need it for all these processes. So, and as we get older, we usually do accumulate some more DNA damage. We accumulate some more inflammation for various reasons. And so the NAD gets used up for these processes. And then also there's other things just in terms of like lifestyle factors, like you have chronic stress, you have a poor diet, you don't really exercise, maybe there's excessive alcohol consumption. Those are all going to contribute to the depletion of NAD. Okay, so what are the consequences of that? Does it really matter? Well, yes. So the decline in NAD levels, it is linked to many different age-related issues, um, and it does impact a lot of our fundamental cellular processes. So if we have lower NAD, we're going to have reduced cellular energy production, which just results in overall lowered energy, increased fatigue, decreased vitality. Um, if we are not repairing our DNA the way it's supposed to, the way that NAD helps with, we can have cellular dysfunction. We have reduced sirtuin activity. Remember, sirtuins are those longevity proteins. And really just it's an impact on our own cellular resilience and our body's ability to respond to stress. And again, this isn't just emotional stress, it's the stressors from outside, from our environment, like I mentioned, toxins that we might come across. So basically, we have this reduced resilience to stress, any kind of stressors that our body comes across. And that is really, and I know we talk about stress a lot of all kinds. Our body is typically good at handling any kind of stress, whether it's stressful environments, just an emotional stress, or if it's from external factors like environmental toxins and things like that. Our body is typically okay at managing it until it becomes too much. So when our body becomes overwhelmed, and we also have a reduction in our NAD, which helps with these processes, you're going to experience, like I said, reduced resilience. Your cells are not going to work as well. You're going to have reduced energy, just more fatigue. And these can manifest in different ways, like brain fog. A lot of people talk about, I'm not as clear as I used to be. And just a general decline of vitality. I just don't have the same energy to do things anymore. I don't recover as well. And low NAD is often seen in chronic conditions like diabetes, neurodegeneration, and cancer. Even though it's not a direct cause, you'll see because this is something like cancer is such a basically like a drain on your NAD. So these are times when, we need to better replenish our NAD. We need better stores of it. Okay, so there are some natural ways that you can boost NAD. So there are, I just want to say, like, it's important to know that there's dietary intake and lifestyle changes can support NAD. It just might not be enough to really significantly reverse some of the age-related natural decline that we have. So of course, like the things that I mentioned before, your diet, your nutrition really plays an important role. You want to give first of all, you want to have the cofactors in there that help with the NAD processing. And you want to have a diet rich in B vitamins because um, things like niacin, nicotinamide riboside, they're basically providing the building blocks to make the NAD. So we always want to provide those building blocks. So things like chicken, turkey, beef, fish, your green peas and whole grains, your mushrooms, your peanuts, your avocado, even cow's milk can contain small amounts of nicotinamide riboside. So those are some of the things in terms of your diet that you can make sure that you have included there to help maintain some of those precursors, the building blocks for NAD. And then there's exercise and fasting. So regular physical activity, especially HIIT workouts, so high intensity interval training, things like endurance exercise, those have all been shown to boost NAD levels, and actually those sirtuin proteins I was talking about, those longevity proteins, helps to improve sirtuin activity. In addition, things like intermittent fasting and some calorie restrictions, so like time-based eating, I like to call it, where you eat in a certain window and you don't eat outside that window. It's a cellular reset. It helps to give yourselves a break so they can do all the housekeeping that they need to do instead of just constantly processing food. So these are a few things that you can do just, in your life to make sure that you're reducing the decline of NAD as much as you can. But like I said, dietary intake, lifestyle changes, they can definitely support your NAD levels, but they just might not always be enough to really overcome some of the age-related decline. Okay, so some people might want, okay, I'm doing all the diet and lifestyle things. I'm intermittent fasting. I am eating all the things. What else can I do? So there are things like NAD precursors and certain supplements. So like I mentioned before, we have things like nicotinamide riboside, niacin. Those are precursors to the NAD plus molecule. So there's research to show that if you take these precursors, your body will convert it to NAD. Your cells basically absorb them and use the specific enzymes to convert them into NAD. It's like taking in all the ingredients that you need for the NAD, and then your body makes it and is able to use it. Just always make sure that, there's so much out there. There's so many people selling things on Instagram and things on Amazon. Just make sure that you're choosing a quality product, something that's coming from a supplement company that has done their own testing. They are independently tested for purity and potency, so they are getting exactly what you're supposed to get. Unfortunately, and I use Amazon all the time, and it's quick and it's fast and it's convenient, but we don't know what we're getting sometimes. Sometimes it is what it's supposed to be, and sometimes it's not. You want to select a reputable brand. It's really hard to say. Um, a company that, like I said, they're transparent about their manufacturing processes, and they have a good track record. They do the research, they're supported by research. And then also talking about dosage, like we want to make sure that you're getting enough. There's a lot of different combination products, which are nice because you don't have to take so many things, but it's just not really going to be enough to make a significant difference to you. Um, while it won't do any harm, it's not maybe going to make the difference that you're hoping for. Okay, and then what about alternative NAD therapies? So what is IV therapy? And that is something that we do here. And there's many different places that do it. And one of the big benefits from doing anything via IV versus via supplement is that we know that everything that we're getting in this IV bag is going directly into our system. It's getting into our blood, it's getting into our cells. Oral supplementation, which I use all the time, you're not getting 100% of what you are taking in because it has to go through your digestive system. So that is one of the big benefits of doing something like IV therapy. So when it comes to NAD, why would you choose an IV over pills? So like I just mentioned, higher bioavailability, it's going to have faster effects because you're bypassing the digestive process. You can get higher doses without having to take, I think people get supplement fatigue. They're taking so many different supplements, and really to reach a therapeutic dose for whatever we are treating. And this can range from just, yeah, I just want to make sure that I am supporting my sirtuin proteins and I'm for longevity purposes. And the other people are maybe they're trying to get over a chronic illness. So they're going to need different doses. And maybe someone else is using it for addiction, so they're going to need a higher dose. So when it comes to things like that, you're going to have to take so many oral supplements in order to reach that therapeutic dose. So IV therapy is really, really helpful in those situations. You can get a higher dose. And like I said, it's just targeted delivery. Direct delivery makes NAD readily available for the cells. It doesn't need to be converted from something like niacin or nicotinamide riboside into the NAD. It's just already there. It's ready to do its job. So yeah, that would be one of the other options when it comes to NAD. And so what are the benefits? I've already spoken about some of them. Um, all the things that we already talked about, increased energy. So we are supporting our cellular energy production. And that just overall leads to more ATP and more just energy, less fatigue. We're helping our cells repair because we have that DNA damage from just regular cell use, as well as just everything that we come into contact all the time. So it helps to repair that DNA, protect the cells from just being able to do what they're supposed to do without any kind of damage. It supports our metabolism. Like I said, when the nutrients come in, um, they use the NAD and the nutrients basically go together to make energy. So it supports your metabolism and also supports cognitive function. So there's definitely cognitive benefits to it. Like I mentioned, people use it for brain fog. People have used it for long COVID. Um, Even, things like addiction, which I'll talk about in just a second. So it can be helpful for cognitive function, mental clarity. Many people, like I mentioned before, come in and use it for something like chronic fatigue. Whatever the um, whatever the root cause of the chronic fatigue is, and there can be many, from viral infections to adrenal dysfunction, hormone issues, everything like that. NAD is that coenzyme that is needed for all the cellular processes. So it doesn't even matter what the root cause is. This can come in and really help support your recovery, along with everything else that we might be doing once we find the root cause. Like I did mention, it has been used for addiction recovery. It helps to reduce withdrawal symptoms, it helps with the cravings, and just supporting your overall restoring the neurotransmitter balance that can get thrown off um, with uh, with substance abuse. So those are cases where you would have to use a higher dose of it. You come in for more sessions up front and then you kind of taper down. So that's why IV therapy is really, really helpful in those situations. So you're not taking in tons and tons of oral supplements and not receiving the 100% of the actual NAD. And I already mentioned the neurodegenerative issues, so supporting your brain cell function and protection. And like I said, post-COVID syndrome or long COVID, it's definitely been used for that as well. So you might have a question about where I'm ready to come in for an IV. How long does it take? How often do I need it? So NAD IV infusions can typically last from 1 to 4 hours. We want to administer it slowly to minimize side effects. So we usually start with a lower dose, maybe 250 milligrams. You can go up to 1,000, sometimes 1,500. Again, depending on what you're using it for, and that's something that your provider will determine what is going to be best for you. But most people are fine starting with 250. So they last 1 to 4 hours. And so in terms of the benefits, you usually want multiple sessions. It's not a one-time thing, because if you think about it, our cells are processing all day long. Every second of every day, it's just our body is working and our cellular processes are continuing to occur. So what people usually do and what is the most beneficial is having like a loading phase where if we've been depleted for whatever reason, whether it's like I mentioned from addiction or if it's from some long COVID, so we've been depleted for a while, there's been some stressor on our system that's been taking our NAD from us. A loading phase can be very helpful. So for something like 4 to 6 sessions over 2 to 3 weeks to really rapidly replenish the NAD. And then you follow that with a maintenance phase. So either it's weekly, bi-weekly, or maybe monthly sessions just to maintain the levels of NAD. And I think some of this got, there we go. Yes, so I did mention side effects. So yes, there can be some discomfort during the infusion. And so the reason why it's administered really slowly is to minimize these effects. So besides the initial IV insertion, which yes, it's a needle, so there's a brief pinch, but after that it should be fine. The side effects that you might experience are something like a little bit of nausea, sometimes a headache, sometimes like flushing. Some people will experience chest tightness, maybe a little dizziness. Again, the whole point is not to be feeling like this the entire time. Most of these side effects are transient and they resolve quickly by just slowing down the infusion rate. We want it to be slow. We don't want you to be feeling like that the whole time. Um, unless you are some of my former colleagues from school who are all guys who would try to see who could get through it the fastest. I don't recommend that. Um, just guys being guys, I think. Correct me if I'm wrong. But yeah, the idea is to do it slowly so that you can infuse over time. You're not experiencing these side effects. If you'll notice that once you start to do it, if you do it more often, um, you will be able to go a little bit faster, but everybody's a little bit different in terms of how fast they can do it. The goal is not to do it fast. You don't need to do it fast. Um, so yeah, I mean, if you do experience any of those feelings during the IV, we usually have access to it. You can do it yourself and slow it down, or you can ask one of us to help you out with it. But those would be the main things that you might come across. Okay, so of course, we always want to just talk about safety considerations. Who is this for? Is this for every single person? No, you always want to consult a provider before starting anything like this. Like I said, it is, especially the lower doses are very safe for most people. Once we get into the higher doses, we want to know, okay, well, why are we doing this? What are we doing this for? Is there a specific plan of what we're trying to achieve here? So yeah, we always want to make sure like you don't have any specific pre-existing medical conditions that might be a contraindication. If you have issues with your liver or kidneys, and again, this doesn't completely rule you out. We just want to know these things, what medications you're on, so we can know, okay, what can we expect? How can you expect to feel? How much is this going to take? Um, Unfortunately, I say like pregnant or breastfeeding women should avoid NAD, just like they're supposed to avoid everything because it's not really ethical to do these types of experiments on pregnant or breastfeeding women. Um, and then also we just want to be careful with certain cancers, specific cancer risks. Again, doesn't rule you out. We just want to know what is going on. How can we safely do this? How can we replenish your stores in a safe way? Um, so yeah, there's constantly more and more research going on with this molecule. It's very active. There is lots of data being studied around the world for different research areas, such as aging and longevity. I think is probably one of the most important ones that or one of the most in the limelight that we've been seeing, but also for metabolic disorders, for neurodegenerative disease, and also for cardiovascular and immune function studies. So there's lots of research still going on. We have been using it for a long time. This is something that we see people just have a lot of success with in terms of like recovering from chronic infections, being able to think clearly again, being able to have energy again. And we also think about it as a long-term, basically like the long game. You think about the long game. I want to protect my mitochondria. I want to make sure that they're able to function well and produce energy because that's like the center of our being, basically. Um, and, like I mentioned, there's a few different ways that you can go about it. You can take oral supplements, you can take IVs, you could even do sub-Q injections. There's also a connection to, I talked about metabolic disorders. There's a huge surgence of what I already spoke about before, the GLP-1 peptides, the GLP-1 GIP peptides. And NAD is very helpful in terms of the energy that is used during these types of stages in your life when you're losing weight, when you're trying to gain muscle, when you're trying to change your body composition. So it is really helpful to have a molecule like that in place too that can help with some of the side effects of those peptides, which some people do experience that fatigue. So they do go hand in hand with a lot of different treatment plans. NAD is something that can be used for most things. Most things that people come in to me for, NAD is usually a helpful molecule that will help with as like an adjunct to what we're doing, whether it's hormones, peptide therapy, like I said, healing our guts, recovering from other kinds of chronic and viral infections. So it really is just, it's a vital coenzyme. It is the vital coenzyme that we need in our body, like I said, from our skin to our, it's all over our body, our brains, our skin, everywhere. So yeah, if you want any more information regarding NAD, whether it be supplementation, whether it be IVs, whether it be how it would fit into your treatment plan, and if you are a candidate for it, please feel free to contact us to find out some more information. You can follow our Instagram too. We post little things that are going to help give you some more information and tidbits and different facts about the things that we talk about here. So please go on there. I know Gavin posted something recently that might give you some more information about NAD and how it works well with our peptide therapy. But yeah, if you have any questions, please let us know. We're here and happy to help.
Thanks for watching. I'm Carol Joy Bender, the founder and nurse practitioner at Joy Wellness Partners. If you found this video helpful, give us a thumbs up. Please subscribe also to our channel and share this video with someone who you think could benefit from it. You can also learn more information about these services by clicking our link in the description below. You can also leave a comment to let us know what content you'd like us to put out next week. Thank you so much for being a part of our community, and stay along with us for enhancing wellness in our world. See you next week.